Hi, Julia O'Shea here. I'm a respiratory therapist who works in pulmonary rehab at the University of Vermont Medical Center. And I'm here today to speak with you about different ways to influence our breathing, or sometimes we refer to it as breathing retraining. So, this talk is directed towards my pulmonary population as well as people who are trying to manage breathlessness related to long COVID, because that is one of the primary symptoms that can show up. I have been working with, I would say, a fair amount of people with long COVID, probably since December of 2020 is when I started to see this population. And what I would recommend that you start with, first of all, is trying to learn how to breathe through your nose. So, one of the questions I ask my patients who are referred to me is, are you more a nose or a mouth breather? And it's one of those things that most of us don't ever have to think about until you actually notice that you're, becoming short of breath, especially when you're not doing anything. So just briefly, I'll talk about nose breathing versus mouth breathing. So nose breathing is the optimal way to be breathing or moving the air in and out of your lungs. And it's really what the nose is designed to do. So the nose warms the air because your lungs appreciate nice warm air. It humidifies the air. Again, warm, moist air is how your lungs best, appreciate and work. And it also helps to filter the air. Another function that the nose does is it actually helps the air to travel deeper into the lungs and with a more smoother flow, or if you're into physics, it's referred to as like a laminar flow. So we want the air to get down into our lungs with ease, versus with mouth breathing, it's really none of it's not warming, it's not humidifying, it's not filtering, and it also creates more of a turbulent flow when you breathe through your mouth, because you can imagine there's more structures inside your mouth and the back of your throat. So nose breathing is usually the first thing that I try to educate people on. Another little trivial fact about nose breathing is that our nose naturally produces what's called nitric oxide. And nitric oxide actually helps to kind of open up vessels or dilate vessels, and it can help to open up the sinuses. So it also helps with oxygenation in your lungs, but that nitric oxide is really good stuff. So the nose naturally produces that. So nose breathing, especially if you're someone who's like, I have allergies, I'm usually plugged up in my nose. The more you retrain your body to breathe through your nose, then it will start to become a lot easier. So first recommendation is trying to breathe through your nose. The other thing that nose breathing will do is it'll naturally force you to pace yourself or slow down, because it's harder to breathe through your nose, especially if you're walking or doing any sort of activity. So usually what I tell people is don't fight it. So if you are walking or trying to move the body and your brain is telling you breathe through your mouth, just breathe through your mouth. There's no reason to fight that or create any sense of discomfort with your breathing. But if you can pace yourself and maybe you start walking a little bit slower than you normally would, and you can maintain the nasal breathing, then over time, it's almost like a training. Your body will start to become stronger and benefit more from that gradual slow pacing, which is at this current time what we're recommending for most people with long COVID, is to not overexert yourself. So nasal breathing. The other thing that I recommend is just being aware of your breathing patterns non-judgmentally. So we all breathe differently based on what we're doing. So for example, if I'm going out for a walk, or even if it's more vigorous, of course, our breathing is going to kick up. We're going to start to breathe faster. when I'm resting, or maybe I'm doing my yoga practice, or I'm just kind of relaxing, my breathing might slow down. So my pattern might be more what I call a relaxed breathing. And even when we sleep, our breathing changes. So just kind of generally speaking, if you don't have any sleep disorders, when we sleep, things kind of quiet down in the body so that the nervous system can go into this regrowth and repair mode. So as we're sleeping, the body's working to heal itself. And the breath also slows down because we don't need to be taking big breaths or breathing fast and things like that. So generally speaking, the breath will become a little bit more shallow and a little bit slower as well. And then of course, because I'm a respiratory therapist, I just have to mention that if you have any concerns about what your oxygen is doing while you're sleeping, or maybe you are dealing with some oxygenation issues, then I would recommend talking to your provider, because there's a pretty, I would say, simple test that they can do where they put a pulse oximeter on your finger when you're sleeping, and then that'll measure your oxygen levels while you're asleep. So you have to be truly asleep when they're monitoring you. You can't wake up and then put it on your finger because your breathing changes. Okay, so being aware of your breathing patterns. So oftentimes when I work with people with long COVID, they tell me that they feel like they can't take a full breath. Like, and I can't tell you how many times I've heard this description. I feel like the breath just gets stuck right here. So the lower part of the lungs, or the area around the diaphragm, right? The diaphragm's that muscle that's deep inside. We can't really see it or touch it, but it's attached to our lower rib cage, even our spine. And what they're feeling is like they go to take a breath and the breath kind of makes it to about here, but they can't get it down into the lower part of their lungs, or even like in their abdomen. So just being aware, is that a pattern that I'm dealing with? Again, not judging that pattern, but just being aware of it, because awareness is step one, and that's how we start to initiate change in the body. Another breathing pattern might be that you breathe fast and shallow, and that I see, I wouldn't say I see it a lot with long COVID, but I have seen people who are just always kind of, it's almost like you're panting because you're feeling short of breath. And I'll talk a little bit more about these breathing techniques, which can help to slow that down some. So just being aware, so really we do breathe in this three-dimensional shape, but again, most people don't think about it until they're faced with breathlessness, right? So that's what I'm here to talk to you about. And I decided I'm just gonna make this a shorter video, so I'll do it in a couple parts. So right now I'm thinking this will be like the part one as far as breathing techniques that I can offer you. So so of course, before you start any breathing practice, what you want to do is just be aware of your breath. So that starts with finding a comfortable position for you. So I'm sitting upright. I'm comfortable, but this may not be a comfortable position for you. So you might have to go find a chair to sit in, or a great way to practice your breathing is to actually lay down. When you lay down, your brain senses that you're not upright, and it can kind of start to shift into more of a restful type of feeling. So that restful feeling can actually help our breathing slow down, and then when we do these breathing techniques, they'll just feel like they're much easier to access. Okay, so the breathing technique, or I'm going to talk about two today. So I consider these more like a functional breathing retraining. So the first one is called pursed lip breathing, and I teach this breathing to all of my pulmonary patients, and I've been using it with my long COVID patients as well, primarily because it's pretty accessible, and you don't necessarily have to be super focused, or you don't have to be like in a quiet environment and things like that. So pursed lip breathing is basically taking a slow, deep breath or slow inhale through your nose, And then you slowly and gently blow out with pursed lips. So I use the phrase, smell the flowers, blow out the birthday candles. So it can be just a gentle breath when you're practicing it. And usually I say practice this breath when you're feeling good, when you're not feeling short of breath. So again, it's a slow, deep inhale through your nose. And then one of the things that you might notice is that your exhale becomes longer. So that's another sort of just awareness you can bring to your breath when we're talking about breathing patterns is, what's the ratio of my inhale to my exhale? So ideally we want the exhale to be a little bit longer. And pursed lip breathing definitely almost exaggerates that lengthening of the exhale. So if you think about the space or the volume in your lungs, you only have so much volume. So in order for you to get that nice, fresh breath in, you have to release the air that's already in there. So that inhale and then blowing out. For me, I can almost feel like it doubles. So I might be at an inhale of like a count of 3 or 4, and then my exhale might be like 6 or 8. So that's something that you can practice to bring awareness to the ratio of your breathing, your inhale to exhale. The benefits of pursed lip breathing, one of the big benefits is that it can help increase your oxygen levels in your blood, because it's literally allowing more time for those oxygen molecules to pass through your lungs into your blood, which goes back to your heart and it gets pumped out to the rest of your body. So it's a temporary increase in your oxygen, which for some people, if you're kind of borderline with your oxygen levels, that can be really helpful when you're short of breath. The other thing that it does is it creates pressure. So your lungs are basically balloons, like tiny little balloons, or air sacs, we call them. And they respond to pressure because it's air. So when you create that pressure at your mouth, the pressure is traveling through the back of your throat, through your airways, and down into those tiny, tiny microscopic air sacs. So if you have part of your lungs that might not be opening and closing the way they're supposed to, it can help to pop them open. And if your lungs are opening better, then it can release more of the air. So that's especially important for people who have any kind of obstructive lung disease. So that helps with their exhale. So with any of the breathing techniques in the pursed lip breathing, while I say it's very accessible, it's not for everybody. So some people do try it and it might trigger a cough or just any kind of sensitivity. So if it doesn't feel good for you, then you just know that you tried it and it's no big deal. These breathing techniques have to be kind of customized to you, and that's why I usually recommend either working with someone like myself, a respiratory therapist, or a physical therapist, or anyone that kind of has that knowledge of the breath and breathing patterns, because they can really kind of help you design your own specific sort of recipe for your breathing retraining. So pursed lip breathing. So you can practice it when you're resting, and then you can take it with you when you go to exert yourself. So say you're walking, you're trying to breathe through your nose, but maybe you're starting to pant a little bit more and you're noticing that your breathlessness is kind of creeping up. If you can try and get in like 1 or 2 pursed lip breaths, it can help to slow your breathing down. The other thing it'll do is it helps to engage the diaphragm. So you could practice that by just finding a comfortable seat in your chair or even laying down, and you could practice your pursed lip breathing and see if you can feel the diaphragm moving. So the movement of the diaphragm when you inhale moves down, and then when you exhale, it moves back up. So it's kind of like this dome shape. So it'd be inhale and then pursed lip comes back up. So practicing that, taking it with you when you're exerting yourself and you're doing things that might make you more short of breath. So it's a very functional breathing technique, again, that doesn't require a lot of focus and concentration. The other breathing technique that I recommend, which again is more functional, is using your breath to support you. And what I mean by that is using the exhale. So when we go to exert ourselves, and I'll use the example of going upstairs, a lot of times what people do is they just want to get it over with, and they just try to get up the stairs as fast as they can, not paying attention to their breath, and they get to the top and they're like, okay, I can't, it takes a while to catch your breath. So what I recommend is that you pace yourself going up the stairs by focusing on your exhale when you exert. So what that would look like is you stand at the bottom of your stairs and you would take a breath in. And then when you go to step up or exert yourself, you can use pursed lip breathing at the same time. Exhale. And so as you're exhaling, you're stepping until you reach, basically the end of your exhale, and then you stop. And you might need to take a breath just to kind of slow it down again. And then you would inhale and then start to exert and exhale. So it might take you a little bit longer, but the idea is that you're not really short of breath when you get up to the top of the stairs, okay? And the exhale with exertion, you can use that with carrying things, with picking things up. A lot of times people feel short of breath when they bend over. So if I were sitting in a chair and I had to bend over to tie my shoe or pick up my pen or whatever, I would just inhale first and then exhale. And then inhale and come back up. Okay, so that can be really helpful. Again, it requires just slowing down and pacing yourself a little bit more, because the idea is we don't want to be going into those breathlessness attacks. Over time, the brain can start to really get into this like neuroplastic, I think of it as like a rut, where it doesn't take much to trigger that shortness of breath. So we want to be retraining the brain to breathe in a way that supports us so that we can be comfortable doing the things that we want to do. Okay, so just to recap what I talked about in this video. So nose breathing over mouth breathing, but don't make it stressful, okay? So if your tendency is to breathe through your mouth, it all starts with the thought or the intention. I'm going to try to breathe more through my nose today. The second thing is just becoming aware of your breathing patterns. And I usually remind people, try to find a restful position at least once a day and see if maybe you can lay down, support your head, and just feel your breath, not judging the breath, and just notice what it's doing naturally. And then be able to just let that go. So you don't have to become attached to it, but you just, for that moment, maybe it's a few minutes, you're just aware, how am I breathing right now? Am I breathing more in my chest? Am I breathing more in my belly? Is my breathing fast? Where is the air moving? Just things like that. So connecting to your own natural breath before you start to change it with breathing techniques. We talked about pursed lip breathing, smell the flowers, blow out the birthday candles, practice when you're feeling good, and then use it when you're exerting yourself. And then lastly, we talked about using the exhale with exertion. So slowing down, inhaling first, and then exhaling to do your stairs, your picking up stuff, carrying things, all of that. So these are just kind of basic functional breathing techniques that you can try. And I'm going to make a second video that will kind of be like the next step. So I'll call it just part 2 to this. And then if you have any questions, feel free to reach out. If you are one of the providers that's watching this video, you'll know how to reach me through my email. If you're one of my patients, same thing, you can reach out to email. And if you're one of my students in class with me, then feel free to talk to me more about it if you like. So thank you so much. Have a great day.